mammograms. But how safe is it to delay your mammogram? Zooming in to talk more about this is Dr. Cedrina Calder, who is a specialist in preventive medicine. Nice to see you, Cedrina. How are you doing today?
Good. How are you?
I'm doing great, thanks. All right, so are you finding that women are concerned about going into a medical facility because of the pandemic and they're skipping their mammograms?
Yeah, absolutely. I think a lot of people have skipped because they're either fearful or they were scheduled. And then when the pandemic hit, a lot of these screenings tests were actually postponed. So maybe they just never followed up and got their test done.
Yeah, what?
But a lot of people are taking a lot of measures to prevent infections. They're doing temp screenings, checking to make sure people are not symptomatic. And they're obviously doing a lot of thorough cleaning and infection control. So I don't think people should be worried about getting the mammograms done at this time. They actually need to be done as soon as possible. Don't delay it. I wouldn't wait a year to delay a mammogram, that's for sure.
Yeah. Of course, you need to supplement that with monthly home breast exams, self-breast exams. How do you remember to do that, and why is that so important?
Yeah, so self-breast exams are not really for diagnose. It's not diagnostic, so it doesn't. What it does do is it helps you to get more familiar with your own breast. So you do want to do them frequently. They don't necessarily have to be done monthly per se, but that would be great if you could get on a monthly schedule of doing them. One way to remember is that when you're in the shower and you're actually washing yourself, just take that time at that point to examine your breast. The more familiar you are with your own breast, the easier it will be to detect an abnormality. And then you can follow up with your healthcare provider to let them know that something just seems different than normal.
Good advice. What other things can we be doing to make sure that we're doing everything we can to prevent breast cancer?
Yeah, so one of the things is just watching your weight. Obesity is associated with the increased risk of breast cancer. So just managing your weight, and you can do that through obviously your diet, the types of food you're eating, as well as physical activity. Also, physical activity, increasing your physical activity is a way to decrease your risk of getting breast cancer. People who don't get very much physical activity are actually at a higher risk of developing breast cancer.
With
So
all
everyone should aim for at least 2.5 hours of physical activity per week.
with all that we know about breast cancer these days, are you finding that the rates of incidences of breast cancer are declining?
Actually, the incidence has slightly increased, and that's probably due to a couple of reasons. One being that people are actually more overweight and obese these days. That's one reason. Another reason may be because a lot of women are waiting to have children. They're waiting to until they're like over the age of 30, and then they're actually having less children. So we know that for women that have children at an earlier age, less than 30, they're actually at a decreased risk of breast cancer.
Okay, and before we go, if there is a woman out there listening today who can't afford to get a mammogram, there are ways to get free or reduced cost mammograms.
Absolutely. So here in Tennessee, the Tennessee Department of Health has a breast cancer screening program. So if you are a woman over the age of 50 and you need a breast cancer screening, you're low income, and you're either uninsured or underinsured, meaning your insurance won't cover it, we do have a program that will cover that for you. If you are under the age of 50 and you have either a history of breast cancer or someone in your family, like a parent, your mother, your daughters, or your sisters have had breast cancer, that could potentially qualify you as well. And then, of course, if you are feeling something abnormal, like a lump or something in your breast, then you could also be screened as well.
All right. Thank you so much for all that good information. We appreciate it. If you have other questions, you can contact your own physician, and we'll put Dr. Cedrina Calder's contact information on our website at newschannel5.com if you'd like to get in touch with her.